and it's probably not permissible. I mean, this is what I read, and I think I tend to this opinion as well. That unless there's an absolute necessity, i.e. there aren't enough female doctors to look after female patients or intimate female issues, then I don't think that a man should sort of specialise in these things. And the issues I was talking about did say that it's actually preferable for, so when you need to do an intimate examination on a Muslim female, it's preferable for, first of all, a Muslim female doctor to treat her. And if you can't find one, then you should actually seek a female non-Muslim before you go to a male Muslim to treat the patient. So I don't think it's definitely not sort of, I don't think it's sort of regarded highly for a man to go into the specialty, but that's what I understood. Did you agree? What do you think?
No, I think personally I agree as well.
Okay.
I just think I'm guessing there's loads of brothers and sisters here that study medicine, right? And when I was definitely in my first, second, even third year, I was always thinking what it would be like. Well, first and second year definitely, when you're actually examining patients and you're going to be trusted with these quite intimate roles. And but to be honest, wouldn't you agree with me that really being professional, like as in having a very professional mindset, is absolutely what you need as a prerequisite. I mean, the thing is, it would ever get dodgy if you had something dodgy in your head to begin with. Do you understand? Like, and I would be like, you might even get like non-Muslim students that would have a different attitude sometimes to things. But on the whole, I mean, if you're a Muslim medical student, whether you're a female doing exams and you're seeing things that you have to by necessity, but it's just important to be professional, no?
No, I completely agree. But I do think, I mean, no matter, I mean, I don't actually suspect that anyone would ever have any bad intentions from doing medicine, because that's not the. You could do dodgy things in other places. You wouldn't go into med school just to do this thing. And I think that the hadith that says that. The hadith that says you shouldn't be alone with a female with the opposite gender, it doesn't actually, it goes further than just saying that you shouldn't perform intercourse or anything. It actually says that you shouldn't be alone, so it's suggesting that even if you think you're a very strong person and you have the best of intentions, don't put yourself in situations like this if there isn't a necessity behind it. So I think this applies to what you were saying as well. It's a necessity as a medical student because you need to know how to deal with these situations if an emergency arises. But if you're specialising in it, then if there are females that do it, then it's not a necessity for a male to go into this kind of thing. That's sort of the opinion that.
Okay. Any other questions?
Yes.
I have a problem with handshakes.
Handshakes.
I would have to go up this week and last week.
Okay.
And every time I go to the club patient, they usually stick their hand out.
Yeah.
And as you know, like opposite genders, most of them are females.
Yeah.
And how do you avoid
But to be honest, I'm not the best person to answer that question because I didn't do much reading about this issue, so I'm not too familiar with the Islamic rulings. I mean, I'm not aware of any direct reference that says that it's haram for a male to shake the hand of a female. I know that the people say the Prophet, never did shake the hand of a female that he wasn't married to. But to be honest, I mean, personally, I try not to sort of initiate the hand greeting. But if someone did it, then I think it's rude to sort of reject them. But obviously, if you can prove to me that it's wrong Islamically, then I think sort of you can't say, I don't want to be rude. If that's Islamic ruling, then you probably shouldn't do it. That's sort of what I think. But I don't know. Do you know any sort of evidence that says there's a direct evidence that says you can't shake a hand with a female?
I heard it's worse than having like piece of metal going through your head.
No, I have heard something, but I have to say that I have to warn people that this is from my experience that a lot of the time people say a lot of narrations of the Prophet that aren't authentic, that are quite weak, and you just have to be careful, because often weak sayings don't necessarily sort of, do you know what I mean? You can't regard them as evidence because they're not authentic. So you have to just make sure that it's authentic, and also don't try and interpret things yourself. You should seek someone who actually sort of knows, or in terms of knowledge about the issue.
Yes, I'm so sorry to keep contributing, but I think Mohammed, I think the issue is that in origin, to touch the skin, whether you're a female touching a male or a male touching a female, to touch someone or part of their aura or even any part of their skin is intrinsically haram, okay, in its origin, for anyone in any normal situation. The question is, does the doctor-patient relationship, or, you know, as it is here in this country, or, you know, does that exclude you from that? Okay, obviously when you're doing physical examinations, when you're, you know, feeling someone's pulse, you know, most people wouldn't think about that twice. But even when you're shaking, you've got to ask yourself, how important is that for the doctor-patient relationship? Or how important is that to the traditions and the culture of the people? How offended will they be and stuff? Do you really have time to educate them and things? But
I think, I do sort of see what you mean, but I think if you think it's wrong, then so as a basic rule, it doesn't matter how offended someone is about you not doing it, then you should stick to what you believe in and say, look, I think this is wrong, I'm trying to explain it in a nice way, I'm sorry. But if we start going down this route, then I think so if you could argue for anyone who's going to any interview, or not just medicine, anything like a shaking hand, because in this country, so I think it's recommended that you shake the hand of sort of your interviewer, whether they're male or female. I don't know, I wouldn't like to give sort of an opinion on it, but I don't know. Okay.
Any other questions?
Yeah, sorry. I've got a problem in my class. One class I have to attend is hydrotherapy session.
Okay.
Then my colleague is a girl, and then the instruction says that we have to bring swimwear.
Okay.
And to me, it's wrong, but certain people say that you're just going to be in the swimming pool, you don't have to look, or you don't have to touch each other or something like that. Yeah. So how should I, basically I skip the class.
Okay.
Yeah.
I think in terms of how important this is to your education, it's not really important at all.
It's not.
Okay, I've sort of had that session as well. So in terms of missing it, it's not a big deal in terms of are you going to suffer medically, in terms of medical education, no. And I think if you think it's wrong, then it's probably the right thing to do.
Because there are lots of other sessions that you have to attend will involve certain things like that. So how do you go about saying you can't do it, or because people don't understand?
What kind of? Because I don't think I wasn't sort of faced with many situations that were that sort of.
I think it's just the hydrotherapy one. Whoever that session actually gave out quite an intensive handout, so if you just kept that handout, you would have been okay.
I mean, I'm not aware of being put in sort of similar situation. This is what I mean. I don't know what the sort of clear answer to this would be. I don't know. You could say that you shouldn't put yourself in that kind of position if you can help it. But I don't know.
Okay. Any other questions? Yes.
Yeah.
I just wanted to ask if there was anything wrong with like the anatomy side of it. You know, when you're dealing with the dead bodies, is there any problem with that?
This was an issue. I didn't read up about it, but I did know. So I've heard some of the issues that some Muslims had with this issue. I think. So as a general principle, in Islam, it's haram to mutilate sort of a dead body, and some people interpret that anatomy. So you could say that's mutilation of a dead body. But I think so I've asked people sort of more knowledgeable than me, and they've said that, again, if we go back to this idea of necessity, is it necessary for you, in your medical education, to learn about the anatomy of the body? And I think people would agree that it is necessary. But you're not sort of mutilating the body out of disrespect. You're actually doing it out of a necessity to understand the anatomy. I think that's how some people justify it. Okay.
Okay. Any
Is it justified if you want to search out for the cause of death?
pathology?
Is it just
Like from an autopsy or exhumation?
okay?
Is it justified?
Okay, I don't know. I mean, I'm not the most qualified person to answer that question.
You just do it in your 4th year pathology session or autopsy. But
Okay.
yeah, I don't know about that.
I mean, I don't think you were allowed to personally perform the autopsy.
You do part of it.
Okay, so we didn't do it.
They do get you through some aspects of it, but you can actually personally opt out of it if you wish. Whether Islamically is justified or not, it's a difficult
I
question.
think we need to ask someone who's a scholar. But I mean, I think so. If you're doing it out of interest, then you could say that there isn't a necessity. But if you're doing it because sort of for educational purposes, we want to know why this person died, so we can prevent something like this happening in the future, you could say that's necessary to do. But I don't think I can say any more than that. I don't know.
Sorry, have you had to deal with any human rights issues like I suppose considering sensitive person. Yeah, but as a doctor, say you had been in a situation where the person wanted to die, I mean, what would you have done?
I've been put in that position myself.
Yeah.
To my understanding, it's wrong for you to haram for a person to actively assist in the death of someone. So you definitely can't participate in that. But with the withdrawal of treatment is not is a different issue. I think it's ethically different to actually actively administering something that might kill someone, to sort of withdrawing the ventilation or withdrawing something that's not you actively, that's allowing sort of a natural course to take place. So I think that's allowed Islamically, whereas doing it actively is not allowed.
Any questions at all?
There's no question. You mentioned accommodation earlier on,
Yeah.
and how you were put in similar positions, and that's where the brothers are as well. Just to let the other students know that actually, alhamdulillah, it's just like if things clash with your Jummah. If you think far enough ahead and get through to the med school and stuff and make a request. Like last year, I made a request when I moved to Gloucester. If I personally, just myself, if I could be in a flat, a men-only flat. And they said, yeah, don't worry, that's okay, we'll sort that out for you. I go there, and it turns out they segregated everyone into men-only and female-only flats.
Just because you told them.
I'm assuming so. Otherwise, they wouldn't. I mean, I don't think they would do that out of standard practice. So, I mean, the point is that don't necessarily resign to what you're down to get. Like if you've got rights as a Muslim, and it's not going beyond your status as a student to actually ask for a few things, because there's nothing wrong in asking for a single-sex accommodation or asking for, like one of my exams right now, the presentation would clash with Jummah 4 weeks in advance. So just today the woman's changed my slot. So it's okay. You can ask in advance and things will happen. I mean, if you're going to complain about it afterwards, then you kind of almost got yourself to blame.
Yeah, I think that's a very good point. And I think sometimes people use their religion as an excuse. Sometimes, like, oh, I'm not going to go to this because they didn't plan far enough ahead. But if you plan enough ahead, you can actually. So people are usually quite understanding.
Yeah.
Okay then.